Hi everybody, good morning, good afternoon, good evening. Welcome to Power of Knowing's LinkedIn Forum, LinkedIn Live episode 166 today. Today we are talking on the topic of the future of remote healthcare, mobile apps as a life savior. And to discuss, we had one of our speaker, but he could not join us. But still, we can go ahead and discuss on some of the pointers that we have, how mobile apps can help us save people on a remote section. What we are talking about is the future of remote health, mobile apps, lifesavers. Here are some of the points that which could make a difference is increased adoption of mobile technology has been rapidly going after the pandemic piece. So, what we see is a current trend where remote healthcare is a key, and most of the points that we see is it has been accelerated over telehealth and remote monitoring solutions. So we have a lot of mobile apps which have come up where we can see mobile helps like the biggest impact on chronic disease management, mental health support. Teleconsulting has played a major role over the period, and these apps have brought up consultation on the forefront and making healthcare accessible more. So what we look at is the apps allow patients to access their information regarding their location, which is especially valuable in rural or undeserved communities. So continuous monitoring and proactive care from a remote app for the heart rate, blood sugar, and others can help detect early signs of health issues before they are escalated. So how do we look at this? How does the medical industry help in looking at these solutions? These are cost effective solutions. They get to know how the patients can be tracked once a registration is done. They can streamline most of the vital checks, and it is cost effective to look at. Apps often reduce healthcare costs by minimizing the need of in-person visits and streamlining the process. How does apps take a role when we look at uh, the AI and machine learning in mobile health apps? That's another question that is coming up with a lot of data being available through these apps. So what these tools can help us do is they can improve us doing predictive analysis. Say how a AI driven app can help predict health issues based on patterns or user data, improving preventive care. So there are multiple apps which are there which help the patient to have a call for emergency, and there are tools which look at sharing these data to the nearby hospitals which they have registered. And this kind of apps have been going around. Like now, if you look at the majority of the hospitals that are there in the industry have their own apps, and they look at promoting booking of appointments through these AI driven models. And they say this is the date that you are supposed to come for a medical test, this is the day you had to have for an eye checkup, there is a regular checkup, there is a consultation that has to be looked at. So these also predict the way the hospitals can look at these uh, apps to help them remotely take care of their prescriptions. Now you have devices which are more advanced where the doctors have been using. There are prescriptions which are written, and that prescriptions come in as a sheet to as an SMS or an WhatsApp image to your mobile. So when you are registered, that paperless way of looking of prescriptions is one step that is going good in the market nowadays. Now, what are the privacy and the cyber security concerns that we should look while we look at the wearable and real-time data collection is the largest thing that is happening. You have an Apple Watch, you have Fitbit and other devices sending a lot of data. That is where when the HIPAA compliance piece comes into picture, where healthcare information is becoming very, very crucial, especially in the UK and US markets where the compliance of patients' records is very, very high. And this brings up a seamless integration with technology and patient data security, addressing concern how mobile apps can handle sensitive patient information, and the best practices should be placed in cybersecurity in healthcare. So, how do we look at this? The importance of HIPAA compliance in the US and similar regulations globally protect data, balancing data and privacy or the healthcare industry. This provides an access to improve only data that a patient's data is visible to a doctor when the appointment is given, which helps the doctor to look only when he sees the patient at a specific appointment time. So this protects even the doctors not to have data of the patients when they want to look at, provided he is mapped with an account or an appointment. So that is the way the regulations have come up in the cybersecurity and privacy of data concerns. Patients' data is become very crucial for the medical organizations to look at and treat them accordingly. Now, how do we integrate much more seamless services? So, the data which is connected or collected over these wearable devices is processed and it is kept to the specific consultant or the hospital that is being used, and can be given access based on the concurrence of the family members or anyone who gives a permission for them to have the access if that person is traveling across. So if you look at currently, the health data can be given access to another doctor, provided he is governing the laws, the best practices, and it is being given approval by the family members for any checkup. Now, what does this help? This helps in uh, looking at reducing the costs of the lab tests that are supposed to be done, and the reports are available for a doctor for another consultation. That is where this whole structure is being brought in. And if you look at the healthcare industry, the examples or the use cases are huge in terms of how data of the patients can be looked at, and preventive care is one thing which is becoming predominantly more important nowadays. Now, with India, we have a lot of old age homes that need these kind of services, where these services look at people who are at the age homes and they need constant monitoring of their health, their tablets delivery. There are services in India where a healthcare person can come in to your house and take you for a doctor's appointment, get you the right prescriptions, and drop you back at home. Those are the services these people have enabled, these pharmaceutical companies and the healthcare departments have enabled. There are a lot of apps that are there which can help in getting these kind of services enabled. Coming to again on the blood bank side. Now, earlier we need to look at how healthcare was to be looked at. If you need a blood, we'll have to ask hundreds of people, at least in the community there. Now, there are a couple of apps which can give access to blood donors around the hospital area that are there. One is the support for, I can say that is one app which is there, support to friends, I think .org is a app that gives you access to blood donors across India, UK, US, I think even Oman, Middle East. These are the places where they have registered donors who can give blood on request. When you reach a hospital and you search for donors around that area, you find donors who can give you the kind of blood group that you want. And that is a very good app that I've been using for last 4 5 years, and it's been a great app. I've taken apps help in terms of supporting most of the patients who were needing of surgery and the urgent blood requirements were there. So I think these mobile apps going forward will enhance the medical care much more and be a lifesavers. Now there are certain tools in the UK and US markets where you can have a person having all the wearable devices connected to him in terms of telling when the person is had his medication, when it is to be refilled, what time is this tablets available, which is the nearest pharmacy that can supply these medicines, who's the nearest person who can be reached. And these apps are having such a tremendous AI capability where they are voice based, and once a command is issued, it searches around the area and finds out and says these are the places where you can get help. And if there is a SOS, and these apps can predict saying that the blood pressure is going low and is somebody is in trouble, they trigger out an alarm to the nearest hospitals. Now, how do we look at having these kind of things? Is the current structure that is going through on the medical field is, or the healthcare field is, there are a lot of use cases in terms of the data that is there with the hospitals, which they are trying to look at if they are able to bring up with the 5G improved connectivity. The role of 5G enhance the app performance so smoother. Telemedical consultants are able to look at data at a very fast, and they are able to give augmented and virtual reality solutions, possibly where users are in the healthcare need is one thing that is coming up over the healthcare industry. Now, looking at the ledger management on healthcare industry, again, the hospitality industries have been using technologies like blockchain for healthcare records, potential to create a secure, decentralized health records accessible through mobile apps. Those are some of the few use cases that we are looking at. Now, looking at the highlights of these apps, there are a lot of apps that can give details of diabetic management, mental health support, emergency response. This can be put across in Indian context and across the globe, where international government initiatives are supporting these kind of developments and use of apps for healthcare. Now, what are the opportunities that you look at for healthcare is, there are a lot of opportunities that you can look at is like senior care is one thing, is which is very very up the kind of thing that is happening in India. At least we have a lot of senior people, and most of our uh, tech guys are not in India. They use these apps to look at senior care, and apps specific to chronic conditions are there. A lot of apps are there. I don't have a right view, but I'll put across the list of apps and the kind of details that we can provide with these uh, medical providers that are there. Coming back to what kind of healthcare apps could be very significant, is there is one app which we've been looking at, is an app called MyCare, which has a lot of options in terms of having a watch wrist that is there. It tracks the person who, when he's leaving, when is he in, what time did he take the medicine, what time was the medicines getting over, what are the blood pressure and the other vitals like what is his heart rate, what is his sugar levels, what is his blood pressure at the moment, and how that can be transmitted to the nearest healthcare for an SOS is what we understand with the current mobile apps that are being there. Uh, with this, I have a limited knowledge in terms of what we are having on the this one. Our speaker who had to join is not joined us today due to some technical issues. I have given his notes what he had given it to me to have it discussed with the audience. With this, I would like to conclude this episode with a short thing. Sorry for not having the speaker today, and looking forward for you to be on the next episode. Thank you. Bye for now.